Dr. Martin Schuettler, thanks for joining MedTech Unboxed.
My pleasure. Thanks for having me.
Absolutely. There's so much going on in the BCI space and with CorTec, so we're glad to have you on to talk about both of those things. And related to BCI, I was reading the other day that Neuralink came out and said that they have a goal of 1 billion US in revenue by 2031 with 20,000 implants, which is a bold goal, but the guy that owns that company has done a lot so far, so I'm not going to count him out.
Yes, we also read that, and I think that's quite a bold statement. In particular, as the market for communication BCIs, and that's what we consider his device to be in the first place. That's a market that still has to be developed, right? So there's very few people today that desperately need a communication BCI, and the market for people that don't have the clinical demand for communication BCI, that market still has to be developed. So having 20,000 devices out there in the next 5.5 or 6 years, that's going to be a challenging task, and we are super curious how that's going to develop.
Yeah, it's bold for sure. Why don't you tell us a little bit give us an overview of CorTec?
Yes, happy to do so. So CorTec is a company that was started in 2010 as a spin-off from the University of Freiburg, that's the southwest of Germany, from various disciplines, from neuroscience to microsystems engineering, computer science, and so on. And that was based on an initiative here in Freiburg where we did very preliminary brain-computer interface experiments with epilepsy patients. Basically, the patients get cortical grid electrodes to locate the diseased tissue. And while they're waiting in the epilepsy monitoring unit for epileptic seizures to happen, some of them agreed to participate in basic BCI experiments. So you can basically read their brain activity and use it, for example, to control a computer cursor. That is something that many people in the world did, and we did so too 20 years ago. And that worked so well, and that was way before AI became big again. So with rather easy algorithms, we could very well predict the intention to move the hand. And that was really a key experiment. We said, that's if we could give those patients that are severely impaired an implant that would allow them to control their computers just by thought, that really would make a difference to them. That was the idea behind starting the company CorTec in 2010. And then many things happened, and today we are looking at the first implantation of the brain-computer interface that we developed, the first implantation in a human subject last week. But this one is not predominantly for controlling technology with thoughts. So the technology has been further developed to also allows brain stimulation. In this case, we make use of brain stimulation to improve rehabilitation after stroke.
Okay. Yeah, let's talk a little bit about that, the unmet needs there in the treatment of stroke patients, neurological diseases. If you can talk about the unmet need there, and then we can get into the tech platform.
Yeah, so in stroke, it's a very big number. 1 of 4 of all of us will suffer a stroke sooner or later. And about 50% of the stroke survivors suffer from permanent inabilities. And I think the stroke care infrastructure is very well developed in the Western world. However, very often the rehabilitation isn't so successful that people, for example, can get back to their jobs.
Yeah.
And the classical rehabilitation is physiotherapy or occupational therapy. And that makes a difference, a big difference to the patient, but there are still deficits that remain. And then a newer concept is that using brain stimulation to improve the so-called neuroplasticity, to improve the ability of the brain to relearn the lost functions. And that is what we're doing. There's more than us out there who works on using implanted devices for a brain stimulation to help the brain rewire. But we are, to our understanding, the first one that want to do it in a closed loop manner. So we don't want to just stimulate the brain. We want to stimulate the brain according to the brain waves, according to the brain's need. That's new. And that should give, besides the anticipated advantage of just stimulating the brain, should give just an extra boost in learning capability. And with that, an extra boost in restoring function to the patient.
This term, can you dig a little deeper into this concept of neuroplasticity related to stimulation?
I try my best being an engineer, but the brain has a natural ability to learn. And of course, learning means new connections are formed in the brain, and the connections are actually strengthened or weakened, and how all those 90 billion nerve cells interact with each other. That's learning. That's adapting to situations. And after stroke, a part of the brain is damaged because by insufficient blood supply or by bleeding. And of course, part of the brain that's damaged causes deficits in whatever brain area is affected. In our cases, it's predominantly upper extremities that are then affected.
Right.
Neuroplasticity is now a concept, a biological concept that is increased automatically in stroke patient after stroke. So the body is prepared for a phase in which increased learning ability is required for a better restoration. So that's a normal thing to happen. But in many cases, the natural neuroplasticity isn't sufficient to restore function in a satisfactory way.
Okay.
And then you can trigger neuroplasticity, improve neuroplasticity by other means that have been demonstrated many times, in particular using transcranial brain magnetic stimulation. So you're not using an implant, but you're using inductive coils that stimulate the brain, inducing electrical currents to flow inside the brain that can induce this enhanced neuroplasticity, and that can enhance learning and rehabilitation.
Okay.
However, the access to these magnetic brain stimulators is very limited. They stand in larger hospitals, at neurological research institutions, but that's nothing you can take home. Mm-hmm. So if you want to provide neuroplasticity technology to like the normal stroke survivor, that's probably not a very good case, because also patient has to come from more rural areas to the centers, and they suffer from inabilities.
Yeah.
So supplying them with an implant that goes together with physiotherapy will make, that's the hypothesis, will make a big difference to them.
Okay.
The way the system will work then is the patient receive an implant to their brain, and the implant is switched on for normal physiotherapy. So it's only active when the normal physiotherapy takes place, and to allow the brain to learn better what's actually rehearsed during exercise during this
Gotcha.
sleep. And afterwards, it's switched off, and the patient, either they are already at home or they're in their rehabilitation centers and so, but the device will not be active outside the normal rehabilitation session.
Okay. It's not continuous. That makes sense.
It's not continuous.
Gotcha.
And that's taking place for a couple of weeks or a couple of months. We're going to figure out in this study.
Yeah.
And then we hope, that's a hypothesis today, still needs to be proven, that we reach a certain level of rehabilitation, that the learning curve is somewhat saturated, and then we can remove the device again. So the patient isn't implanted for the rest of his or her life. It is part of a rehabilitation process to have that implant, and then it's going to be removed again.
Okay. Excellent. Thanks for going over the unmet needs in stroke care and this concept of neuroplasticity. I loved how you explained it. Can you share with us a little bit about the CorTec tech platform?
Yes. So the CorTec implant is a platform technology that we call CorTec brain interchange. Yeah? And the name says it's interchanging information with the brain. It consists of electrical contacts that are as grids placed on the brain surface in a surgical procedure. And these grid electrodes are connected to an electronic unit that is to be implanted between the skull and the scalp. So the electronic is not in the brain, it's only the electrical contacts that sit on the surface of the brain.
Okay.
But the implant by its concept is really inspired by cochlear implant. It requires body external little transmitter that sticks to the skin that supplies wirelessly power to the implant and wirelessly communicates with the implant.
Right.
So the person who is operating the implant will have a little knob sticking to the head, suspended by magnetic forces. This knob is then connected to a computing unit. That can be a small wearable computer. In many settings, it might be a laptop computer. It could be anything that can compute. So the concept is the device is constantly sensing brain signals, electrical brain signals, amplifies them, digitizes them, and sends them to the portable computer. The portable computer can then use that brain signals, process them, can control technology, can be used to, let's say, write a text on a computer screen, but it can as well use this brain information to take decisions on therapy. So in our case with stroke, it tries to find the signature of the beta activity of the brain. There's a certain brain wave around 20 oscillations per second. If that's identified and it reaches a certain threshold, the algorithms send commands to the implanted device, which executes those as stimulation stimuli. So they deliver electrical pulses to the brain. So that's what we call closed loop, right? It sends this brain activity. The brain activity is analyzed. There's a need identified. This identified need leads to therapeutic doses, in this case, as an electrical current delivered to the brain. And while it's delivered, the brain is already monitored again, sees if that's been delivered successfully, if the result of this stimulation is what we anticipated, or do we have to deliver a little bit more next time or a little bit less, or use a different contact. So it's going continuously in closed loop, sensing and, if required, stimulation.
Wow. Closed loop control.
Closed loop control.
Do you have a visual that you'd like to share to describe this?
Say it again.
Do you have a visual that you'd like to share to describe?
Yes, we got a little illustration of how this system is placed on a brain and a skull. That is I think is that something that you would now show? I think I can share. Did I start?
Center. I want to share your screen.
Okay.
Yep, there you go. Perfect.
Yeah, perfect. Thank you. Yeah, so that's an illustration of the actual implant. In this case, it is an implant that we designed in particular to be applied for stroke. Also, the electrodes might not sit in the situation and the location where they are now located in our first patients, but it is the original design. So you see on the top of the brain, these are very flexible silicone grids with electrical contacts. These contacts face towards the brain and sense brain activity, but can also deliver electrical pulses to the brain. These electrode grids are connected through cables to a device that sticks to the side of the skull, and that is actually the implanted electronics inside this whitish box. That is where the electronic is hermetically sealed against the humidity of the body. And you also see a golden copperish coil that is where inductively power is received. So that's where the device is supplied wirelessly with power. And in the middle of this coil, you see a gray disc. That is a magnet. So when you want to power it, this magnet corresponds to a magnet of what we call a headpiece. And they allow an automatic alignment of body external cylinder and the implant, and also allows the headpiece to be suspended.
Okay.
Yeah, and it could be used for many things. We were already discussing two fields of application. One is using the brain data to control technology, for example, using speech decoding or for controlling a computer cursor and so on. Mind control of technology. But it can as well be used as closed loop therapeutic application. There are many indications that are now researched, now that there are tools to research different ideas how to better treat brain conditions like stroke, epilepsy, and so on.
Okay. Excellent. Thanks for sharing that. Let's get on to some exciting clinical milestones recently achieved. If you could get into that a little bit. Some big news.
Yeah, big news. We got last week our first stroke patient implanted with this device. And that is done together with a research consortium around the University of Washington in Seattle. And we had the chance to implant that device in Harborview Medical Center, also in Seattle. We got a stroke patient that is who had several strokes in the past and wants to improve his functionality in his left hand, which is impaired. And we got this, of course, this is a long-running project that we started a couple of years ago, funded by National Institutes of Health. And we got that together with our clinical partners, Professor Ogeman from University of Washington and Steve Kramer from Los Angeles. And we got this fantastic consortium together with also occupational therapists. We got the neurosurgeons and so on. And now this team met last week in Seattle, met the patient and planned the surgery. And in the morning, we got the patient in the surgery room, and without less than 2.5 hours, everything was done. Yeah, so the implant was very elegantly by our surgeons placed in the head, and wound flows. We could start the system. All functions work super nicely. So we were really surprised how smooth that went and how fast that was. And the patient, of course, we got in this project criteria for the patients to eventually leave the hospital. So there's, of course, several aspects on health, but also we wanted the patient to stay at least 24 hours in the hospital so we could keep an eye on him. And after the 24 hours, it was clear this patient is doing fantastic, and he left the hospital the next day. Yeah. So he actually got that very, very well. He recovered quickly. However, before we start with the actual study, we planned in total a 4-week recovery phase after the surgery. And now we are 1 week into this 4 weeks recovery phase. So there's another 3 weeks before we switch on the device and start sorting out how the different contacts are placed and what are the right stimulation paradigms. And so 2 weeks, what we call calibration or warm-up phase before the actual rehabilitation stimulation phase begins. But it's super exciting and everything went so smooth. We are so grateful. And of course, so grateful that we got a very nice and very enthusiastic patient who wants to be a pioneer in this.
Yeah, that's very exciting. And everybody CorTec must be very excited to follow the progress that's upcoming, right? I mean, just began.
Absolutely. Yeah.
There's a lot to keep up with over the next several weeks, right?
Absolutely, yes. And the study was approved, of course, by FDA as an investigational device exemption study, and they allowed us to do 4 patients.
Okay.
And these first 4 patients have a treatment of continuous brain stimulation during their rehabilitation sessions. And at the end of their implantation period, we have 2 weeks to work with on closed loop stimulation. So the first part is only a new device and continuous stimulation. We anticipate a very good progress with just stimulating the brain. But our real interest is how much better we can be when we actually do it closed loop. And for the first 4 patients, we are allowed to have a short test phase of 2 weeks at the end of the implantation period. And if that works well, we want to go for an amendment, going for another 8 patients in which we apply closed loop from the very beginning.
Oh.
So it's a 2-phase study, really. And all those is new and super exciting.
Wow. I'm definitely going to be following the progress, especially as you go into the phase where you're implementing closed loop.
Yes.
Yeah. Okay. Well, thank you for giving us an update on that very exciting clinical milestone. We're looking forward to following that. And thanks for taking the time to join me today on MedTech Unboxed, Dr. Schuettler.
Absolutely my pleasure. Thank you so much.
Okay. Bye-bye.